Good afternoon, everyone. This week, Ontario saw a slight increase in cases, while the number of new cases in Grey Bruce declined, with only 12 new cases this week. Hospitalizations, patients in ICU and on ventilators in Ontario were very similar to that reported last week. Deaths were down slightly. The two new cases reported yesterday in the town of the Blue Mountains and the second death reported this week by the Grey Bruce Health Unit remind us that COVID is still here. In addition, new variants circulating next door in Simcoe County are a cause for concern. Residents are strongly advised to avoid close contact with people from other regions where these new variants are circulating and to avoid travel to those areas unless absolutely necessary. Now is not the time to let down our guard and stop doing the things that we have done to keep our community safe. The vaccination program in Grey Bruce is picking up speed. On Monday, the Grey Bruce Health Unit reported that the first dose have been given to all residents, staff, and essential caregivers who consented to the vaccine in all 19 long-term care and 7 high-risk retirement homes in Grey Bruce. In addition, those who were first to get their vaccine in January have received their second dose, and the Grey Bruce Health Unit anticipates that they will have sufficient supply to ensure the second dose for all residents, staff, and essential caregivers within the recommended dosing schedules. To date, the health unit has administered 3,759 doses of vaccine, putting the health unit on schedule to move through the province's framework for vaccine administration, which dictates that when all reasonable steps have been taken to complete first dose vaccinations of all staff, essential caregivers, and residents of long-term care homes, high-risk retirement homes, and First Nations elder care homes, first dose vaccinations may be made available to the remainder of the Phase 1 populations. Phase 1 populations include adults 80 years of age and older, staff, residents, and caregivers in retirement homes and other congregate care settings for seniors, healthcare workers in the high priority level, all Indigenous adults, and adult recipients of chronic home care. In Grey Bruce, persons 80 years of age and older are currently being identified through the healthcare system for eligibility in the COVID-19 vaccine program. All eligible persons will be contacted directly in the near future to schedule their vaccination. Please do not call your healthcare provider to book an appointment, and please do not call the health unit to book an appointment. They will contact you. For those without a primary healthcare provider or residents whose primary healthcare provider is outside Grey Bruce, a 1-800 number will soon be available to book whoever was not captured through the healthcare system. Be reassured that all eligible persons will be reached through a variety of communications channels. Since vaccines are allocated to municipalities by their permanent populations, residents must be vaccinated in the municipality of their primary residence. Please continue to watch local media and the Public Health Unit's website for updates as the vaccine rolls out to the different priority populations. This afternoon, Ontario moved the Grey Bruce Health Unit into the green or prevent zone from the yellow or protect zone. Most gathering limits and restrictions remain the same, although some limits, for example, on class signs in gyms and on bar and restaurant hours, are slightly relaxed. Public health advice remains the same. Stay calm, stay kind, and stay well. Follow the 3 W's, which are washing your hands frequently, watching your distance, wearing a face covering correctly, and the 2 A's, avoid crowds and arrange for outdoor activities instead of indoors whenever possible. Have a great weekend and stay safe.